My name is Dr. Ruth Large. I'm an emergency physician and rural hospitalist. I work for the Waikato District Health Board, and for the last 4 or 5 years I've been the chair of the New Zealand Telehealth Leadership Group. We've seen pockets of excellence in telehealth up and down the country for some years now, where people have recognised that they need to deliver care to patients remotely, so where the clinician and the patient is physically apart, and that's been a really important part of many practices. What we haven't seen so much of is primary care development and a large-scale telehealth. So at this point in time with COVID-19, really what we're seeing both patients and providers being asked to lock down, stay home, stay safe, don't pass your germs about. And that's really put a lot of emphasis on the desire for both patients and clinicians to be separated physically. And this is where telehealth is such a bonus, because we can still talk to each other face to face, receive really great healthcare, still get prescriptions without actually having to have that physical need for touch. I think we've been very fortunate to have had the New Zealand Telehealth Leadership Group have a lot of information before we went into this. So very quickly, within a few days, we were able to say, well, look, here are the barriers. We know what the barriers are. The biggest barrier to particularly in primary and secondary care, to providing good quality telehealth, has been the ability to prescribe. Because you had to have a physical signature, somebody had to sit down with a pad, prescribe it physically, and then getting that to the pharmacy has been difficult. So within a very short period of time, we've seen the ministry step up with us to help us lose that emphasis on a physical signature, and also be able to, for instance, the Medical Council has loosened its stance on the prescribing of psychotropic medications by telehealth. And both of those things have really helped us to be able to reassure our primary and secondary care clinicians who are providing prescriptions that they can do this safely in an electronic form, which has been really great. I mean, that's, less than 10 days, they were able to do that, create those waivers to the legislation, which is awesome. I think a lot of clinicians worry about providing care safely, and they want reassurance that if something does go wrong, that patients and clinicians are supported. And the Medical Protection Society have been really great at providing a really, I think, comprehensive statement, which is really more about using your common sense, doing the right thing. If you do the right thing with the right intent, then it seldom ends in harm. So it's continuing to practice the way you normally would, and knowing where the risks are in telehealth, knowing that you can't physically examine, for example, that has been important. And the Medical Protection Society guidance on this, I think, is really excellent. And it's great to see them come through with this guidance so rapidly. I think in terms of accessing to information, there's some really great information out there. And really what we want at this time is we want New Zealand specific information, which is designed for New Zealand clinicians, but also designed for New Zealand patients. And those resources come in the form of Health Navigator, for which the Telehealth Leadership Group has a really close relationship with, and of course the New Zealand Telehealth Leadership Group itself, which works with the ministry, and the website for the New Zealand Telehealth Leadership Group is the New Zealand Telehealth Resource Centre, www.telehealth.org.nz, and there's updates there all the time. You can also subscribe to the newsletter, and we link in with Health Navigator for patient resources, so it's a great place to go. The recent articles on Zoom have been really interesting. I think it's highlighted for everybody the need to be aware of the potential risks to everything we do electronically, and to pay attention to cybersecurity. In terms of that sort of hacking into Zoom, if you like, you can liken that to the prank calls where people can pop in potentially into a video conference. Now, those things can be mitigated with things like the doorbell function, closing meetings when everybody's already in the room, and setting pins So there's been some really good advice, I think, on the Telehealth Resource Centre site, and the advice that the GCSIB have given us in that regard. I think the important part, though, is for this not to put people off. There's lots of really great tools out there. It's using them carefully. And if your DHB or your provider, your PHO or your local organisation has a particular tool that they've already done all of the work on and making sure that that's secure, then use that first. In terms of Zoom, I think you need to be sensible, use the advice that we've provided, and keep yourself and patients safe. Look, on behalf of the New Zealand Telehealth Leadership Group, we'd really like to thank our partners, but most of all, we'd really like to thank the clinicians out there who've just embraced this really challenging time and stepped up to support their patients to be able to stay safe at home. So, from those physiotherapists, occupational therapists, all the way through our GP services, nurses, senior medical staff, and our DHBs, and of course our amazing GPs. Thank you so much for taking up the opportunity to provide such great healthcare for your patients during this COVID-19 epidemic.